And for more, let's bring in CTV News infectious disease specialist, Dr. Abdu Sharkawy. Good morning to you, sir. This stay-at-home order, in effect, it's leading, it looks like, to a lot of confusion. Are you worried that this confusion could cause people to just not abide by these restrictions?
Well, I'm not sure that this provides anything but a symbolic gesture. And frankly, I think we're beyond that at this point in time. There are too many vagaries about what people can define as essential or non-essential. There's all kinds of uncertainty and confusion around how enforceable this will be. Do we have enough police officers and bylaw officers to go out and actually ticket and fine people for this? Is this the best use of their resources or time? Frankly, I'm disappointed that this is the approach that we're taking rather than looking at helping people and helping the essential workers and those that are trying to do their best but have no choice but to leave home. And I think that's really what's missing as a key element of trying to stem this pandemic. I'm very concerned about people who work in the essential work environment in hard-hit, hot zone places. They're not getting paid sick leave. They're not getting access to testing. They're not getting isolation facilities and support that they need. And I think that that would be entirely more helpful and more constructive than telling people that they just need to stay home. I think people have known that they should be staying at home for weeks now.
Yeah, and that really was the big question a lot of folks were asking since these measures were introduced earlier this week. What exactly does this mean? How has the situation changed, and what does this mean for enforcement or lack thereof? And to your point, a lot of your colleagues asking for more support for healthcare workers. Speaking of which, you and I have discussed this at length, the dire situation you and your colleagues are facing now with respect to limited, if no capacity at all in ICUs. You tweeted this, your ICU colleague in Southern Ontario texting you, I'm transferring COVID-19 across regional ICU to load balance. It's like snakes and ladders, Dr. Sharkawy.
Yeah, that really just sort of hit me. I stay in touch with a lot of my ICU colleagues around the province, and I'm increasingly getting very worried about what's happening to them. I mean, simply finding beds and spaces for patients sounds like it should be easy enough, but this is an enormous undertaking. It's not a safe thing to have to send patients, potentially 100 kilometers away to another ICU when they're critically ill. That takes up a lot of time and resources, and it's not necessarily the safest way to monitor patients. And yet this is becoming commonplace now across the province. And at some point, the safety valves of places like my hospital, for example, that's been accepting patients from Barrie and Scarborough and Brampton, I mean, we're going to fill up. This is not sustainable. It's something that really needs to be addressed. And our surge capacity is only going to go so far. And it's going to harm people and limit the care that we can provide for people who are having heart attacks and strokes or come into the emergency room with a serious car accident. We don't want to be in that position where we can't offer them the most ideal and safe form of care because our ICUs are full.
And I think it's also important to highlight as we look at these visuals with these frontline workers wearing the yellow gowns. I was there. I saw that firsthand. Just the time and the resources needed. Do people understand? I hope they understand that every time you or one of your colleagues visits a patient who has COVID-19 or is suspected of having COVID-19, you have to not only mask up, you have to shield up. You got to get that gown on. You got to put new rubber gloves on. Go see the patient, even if it's for 2 seconds, just to touch a bag, a bag full of fluid or what have you, only to leave the room and come back again and do it all over again. How exhausting is that? And necessary.
It's absolutely necessary. Obviously, our PPE protocol is something we take very, very seriously, but it is a source of angst and distress, particularly when you work long hours and your shifts are long and you can ill afford to make one mistake while you're donning or doffing your PPE attire, because that might be all it takes to become infected with this virus and to spread it to others. So yeah, it is time consuming. It's angst provoking for sure. And it's an unfortunate consequence of living in the middle of a pandemic where we're seeing growing numbers everywhere you look, particularly in hospitals now.
You got it. And I know you're looking for the vaccines too. You have your 2 doses. A lot of folks saying, where's my dose? Millions and millions of Canadians are waiting to get vaccinated from this vicious virus. How concerned are you about the rollout? Is it improving fast enough for you? Where are we here?
I think it's improving. We've done a little bit of a better job over the past week getting into long-term care facilities, but nowhere near at the pace or rate that we need for particularly long-term care facility residents and their staff. That is a situation that has been on fire now throughout this pandemic. I think we need to enlist the support of pharmacists and family physicians and anyone who's already trained to administer these vaccines and get them going. Honestly, I just don't understand where the lack of will is here to execute a plan. Speed trumps perfection. We don't need to have a perfect plan, but we just have to get as many people vaccinated as possible. And I urge the Premier and the Ministry to really put their heads behind this and get things done.
All right, CTV News infectious disease specialist Dr. Abdu Sharkawy, thank you for this.
Thank you. Stay safe.